lot of people did not know that when they sign that consent form that they're signing that part that says exam under anesthesia is an exam with multiple people are performing.
And welcome back. You are listening to Hysteria, the podcast for people who know when it's time to drop Dr. Google and talk to a real medical professional. So we wanted to bring in a doctor to talk about this next topic for reasons that will become clear very quickly. On Monday, the Department of Health and Human Services announced that patients receiving any, quote, sensitive exam, including pelvic and prostate exams, particularly if those patients are going under anesthesia, must give explicit written consent before the exams are performed. So this comes 4 years after a disturbing New York Times investigation found that hospitals conducted non-consensual pelvic exams on women under anesthesia. Oftentimes, these exams weren't necessary and were just done for educational purposes for doctors in training. So, I mean, from the perspective of a patient, kind of seems like medically endorsed sexual assault. It isn't uncommon for medical students to conduct breast, rectal, and prostate exams on unconscious patients who may have signed forms weeks in advance of medical procedures, not knowing that they were consenting to having med students practice probing their unconscious bodies. Believe it or not, this was only prohibited in a handful of states at the time, although in recent years, more states have passed laws prohibiting this practice. Here to help us figure out what was going on, what is going on, and what will be going on is a Hysteria favorite. She's a board-certified OBGYN, an Army vet, and a sex and reproductive health activist. You can follow her on Instagram, and you should follow her on Instagram and TikTok for some of the best content out there. Dr. Heather Irobunda, welcome to Hysteria.
Hi, guys. Good to see you guys again.
You so too. Good to see you always. But can you please start us off by helping us figure out what the fuck is going on?
Yeah, so this was it's a practice that I think is diminishing in medicine, if that makes sense, but definitely a thing. It's not made up. It's something that even as a medical student, I remember starting my OBGYN rotation, and it's like, yep, so one of the main ways you're going to learn how to do a pelvic exam is during a surgery for, hysterectomy, any sort of procedure where a patient is, asleep, anesthetized, and it would be the attending physician. So that's the one who you probably spoke to during your appointment, who you signed off to do the surgery for, any residents involved, any students. And it was unnerving, but we were told that that's what happened and that's what we do.
Oh my gosh. So in some of, yeah. So that what do you think of the new HHS standards to make sure that patients have like affirmatively consented to sensitive exams before they're put under anesthesia?
I think it's absolutely necessary. They actually passed a law about this in New York a few years ago. And so in New York, we explicitly have to get affirmative consent for these types of things. And what I think is pretty cool, actually, is that oftentimes we have a conversation with the student and the attending physician. So like oftentimes what will happen is that, and we love to make sure that we let the patients know, hey, you don't have to be okay with this. You can say no one's going to get offended. It's not going to mean that you won't be able to get your surgery or your procedure, but we take time to explain it. And it actually gives the students a lot more time to talk to the patient, to get to know the patient gets to know them. And I think it's a step in the right direction, but it's definitely something that needs to be done because I agree. I feel like a lot of people did not know that when they sign that consent form that they're signing that part that says exam under anesthesia is an exam with multiple people are performing. And I believe that it needs to be clarified, and I'm happy that we are clarifying that.
Because you know what, Dr. Heather, here's how I felt when I was reading all of this. If someone asks me, probably 90% chance I'm going to say yes because I know it's happening. I know I'm contributing to something, but it feels a bit like, I mean, it's kind of weird, but it feels a little bit like organ donation. Like, yeah, I just want to sign. I just want to say I understand and I'm doing it. But like if I were to wake up and it had happened, and you can sort of maybe feel that it happened, I'd feel violated.
Exactly. And that's something that I think is a move forward in medicine, because oftentimes what I notice, especially when I was training, and I'm not that old, but I feel like these days, I feel like back in my day, it kind of makes you feel old. But like the way that we were taught was that, oh, people don't know what's good for them. Women don't know what's good for them.
Of
They're going to say
course.
no, they're not going to let us do this. And I'm like, most people are reasonable. And if they say no, it's for a good reason. And maybe we should listen to that and not do things that you think people are going to say no to. Maybe we should re-examine what we're doing instead of saying, well, we know it's right all the time.
Right.
Yeah. Reading these reports and reading about the new guidance kind of reminded me of how birth tends to go. Like with my first birth, I worked with a doula and we came up with a birth plan, which, as a provider, that planning is not something that birth really does. It doesn't really work. It's kind of like an unplannable thing, but you come up with a list of preferences before you go into birth, because otherwise you go into a hospital and a lot of providers and a lot of facilities will just kind of assume that they know what's best for you and just do things to you without asking. Like before I gave birth, I had to really specify that I didn't want male providers without like direct verbal consent right before they entered my room. It's my preference. I had to specify that I didn't want I wanted cervical checks minimized, because otherwise they just like come in and touch your cervix while you're like in the process of giving birth. And there's like not a ton of, there's information that sometimes it's useful and sometimes it's not useful. It's just the thing that they do. How else are you seeing that like the OBGYN profession is evolving to empower patients more?
I think people are really taking the chance with telling patients, like they're taking the opportunity to tell patients what they're doing, because I feel like a lot of times we just weren't taught that. We said that, hey, you're in our space. This is what we do. You're probably not going to understand it. And if you say no, it's against your best interest. But I think now, just even saying before you're going to touch somebody, can I touch you? This is what I'm going to do. This is why I'm doing it. I think more people are trying to take the opportunity to do that with patients. And I think that's so, so, so important. I think that even having conversations about why we're prescribing certain medications is really important, because I think that all too often, many of us, especially if we were prescribed birth control, like, I'm in my 40s, prescribed birth control when I was in my teens or 20s, they were just given to us and said, okay, cool. Like, good luck. You have acne. This is for that. You have this is, you have heavy bleeding. It's for that. But now I think we're taking the time out to really explain things to patients and say, hey, I think you can understand this. Is this something you really want to do? And these are the reasons why. I think, allowing folks to bring more people into the exam room. Like, so for example, I felt like before people were very reticent, like physicians, hospital folks were like, oh, have your partner step outside, or, those types of things. And I think we're now moving to the direction of having more people involved in the care, like making it a communal space. I wouldn't say everywhere is doing that, but I think more places are leaning towards that, because we know through research that this helps people live their healthiest lives, get the best out of the care that we're providing.
Mm-hmm. And as a patient, how can you advocate for yourself with a provider who maybe isn't as progressive when it comes to seeking consent?
I think verbalizing it, and I know it's hard because of the perceived power differential and the real power differential sometimes in those rooms, especially if your provider's coming off cold and you feel like they're not listening to you. But sometimes you need to pause them, because oftentimes they're humans too. They may be going through something in their, the rest of their day that you're not privy to, and you don't realize that maybe that wasn't their intent. Maybe they did want to listen to you. Maybe they're just having, a bad day or something like that. I like to see the better in people, I guess, but I think you need to stop people in their tracks and say, hey, like, can you tell me what's going on? Is there an exam going to be involved? Who's going to be doing the exam? Asking questions, stating what you don't want, because I feel like once a patient, sometimes if I'm not even thinking about it and a patient tells me, hey, just FYI, like I want to minimize cervical exams or something like that. Even if I didn't explicitly ask you about that, you have now reminded me of that. And I'll say, okay, cool. Let me put that in your chart. Let me, communicate that to the team. So I think really verbalizing what you want is key. And if you're not able to do that, to tell somebody who's close to you who will be there, like especially if you're in a birthing situation, let's say it's your doula, your partner, your friend, your family member, let them know the types of things that are absolute no's for you. And also tell them to feel empowered, that they know you, right? Because I feel like a lot of times you may not explicitly tell the person you're with everything that you would want. But if my partner knows me or my mom knows me or someone like that, they would know that maybe I wouldn't be down for 5 people doing an exam on me at the same time. Maybe I wouldn't be down with a male provider. Maybe I wouldn't be down for these things. And I would just let those folks know that, hey, if something sounds like a procedure or a situation that I would not want, please make sure that you let them know my wishes if I'm not able to do that myself.
Well, Dr. Heather Irobunda, thank you so much for helping us understand this story a little bit better, and for the great advice on how to advocate for ourselves for more consent from our providers.